Sometimes a presence is so steady you may not notice it changing. For over 65 years, we've been constantly innovating. And in partnering with Ochsner, we continue to offer the most advanced technology with minimally invasive techniques for general surgery and for specialties from orthopedics to neurosurgery. Many have noticed, earning us the most accolades on the North Shore for quality, safety, and patient experience. St. Tammany Parish Hospital in Ochsner, shaping the future of health.
Hello and welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Melissa Hodgson, and I have with me today 3 leading voices in children's resources on the North Shore. We'll talk with Cindy Ingram, Director of Women's and Children's Care at St. Tammany Parish Hospital, Melissa O'Malley, Assistant Vice President with Ochsner Health System, focused on West St. Tammany Pediatrics, and Lori Cage, Director of the Parenting Center. Good morning, Cindy. Glad you're here.
Thank you. Excited to be here.
Wonderful. Well, we are talking about the most comprehensive health system for children along the I-12 corridor, Ochsner Hospital for Children at St. Tammany Parish Hospital. So I'm interested to hear from you about inpatient resources at the hospital and how Ochsner specialists are working with us to create the most comprehensive health system for children on the North Shore.
Okay, great. We have always had the pediatric unit at St. Tammany, and we've recently added the pediatric ICU, which is the pediatric intensive care unit. This is in collaboration with Ochsner for Children, Ochsner Hospital for Children, and we are excited that we have the pediatric intensivist with us from Ochsner. The unit is newly designed, brand new rooms, 4 rooms, pediatric ICU. In the rooms, there's state-of-the-art equipment, brand new equipment. We are able to have cardiac monitoring. We have videos in there, a video camera in there that we can watch the children 24/7. Because in ICU, it's necessary to visualize those children the whole time they're there. So we have that available. We're staffed with pediatric ICU nurses who are trained in intensive care for peds. And they come with experience from various places. We were so excited to get them at St. Tammany. And as I said, the pediatric ICU physicians staff not only the regular acute peds side, but also the intensive care side. And that's in collaboration with Ochsner and the Ochsner Hospital for Children at St. Tammany Parish Hospital.
Wonderful. So you're saying essentially that the capabilities inside of St. Tammany Parish Hospital with those Ochsner intensivists, that's the whole reason for calling it Ochsner Hospital for Children at St. Tammany Parish Hospital, because we have general pediatric inpatient care and intensive care for pediatrics. Correct. And that is a collaboration between our 2 hospitals.
That's correct.
Outstanding.
Yes. We're able to keep children that we in the past would have to send either across the lake to the South Shore, to Baton Rouge, or even out of the state. We had the capability to take care of pediatric acute conditions, but if that condition became more serious and needed a higher level of care, we would often have to transfer out from our pediatric unit or even from the emergency department. Conditions such as diabetics, sometimes they get in a crisis situation where we have to take care of them in an ICU situation. Several respiratory conditions warrant ICU, neurological conditions, things like that. Some surgeries for the first 24 hours need an ICU area.
Wonderful. So this really drastically increases the pediatric capabilities inside the hospital. Yes. And then downstairs, the hospital also has a pediatric emergency department, and that's 24 hours a day, 7 days a week. It never closes.
Correct.
Can you talk a little bit about that?
Yes. A few years ago, the emergency department underwent a whole renovation and expansion. And within that expansion, they created a pediatric emergency department. The rooms are specialized for children. They're geared towards children. The way they're decorated, the colors, the setup, the equipment that's over there. There's a separate pediatric waiting area for the emergency department. And the staff in that area, just like the pediatric ICU, are trained for children. So we have nurses who specialize in pediatric care. We have physicians over there who are staffed 24/7, as well as the nursing staff. We were at a 12-hour, staffed that area for 12 hours for a while. And when we opened the ICU, our plan was to expand it to 24/7. So anytime you come in for emergency services, with your children, you will be seen in the pediatric emergency room.
Outstanding. So at St. Tammany Parish Hospital, you have Ochsner Hospital for Children, pediatric intensivists upstairs in the pediatric intensive care unit and the inpatient pediatric unit.
Correct.
And then downstairs, the pediatric emergency department is always open, never closing, ready to see children at any time. And those two can collaborate with each other
Yes.
on pediatric emergencies that may in the past have had to leave the area.
Yes. And what also happens, because we have the pediatric intensivists in-house, when they're there, they will go down to the ED to evaluate the patient to make sure, we'll take the patient in our pediatric ICU. There are a few cases that we will still have to transfer out. Just certain specialties are very high-level cases, but for the most part, we can keep everything on the North Shore.
Outstanding. Well, that's all inside the hospital. And then there are also resources that are part of the comprehensive pediatrics available through Ochsner Hospital for Children at St. Tammany Parish Hospital. St. Tammany has pediatric therapy down the street from the hospital. Can you talk a little bit about that?
We just finished building a state-of-the-art building near Flowers Estates on 21. If you drive down 21, you'll see that very easily. Very excited about the new building, and in that new building is an area specialized for children. So we have speech therapists, occupational therapists, and physical therapists who are trained in pediatric care as well. Their therapy is a little different and involves play. That's how you treat the children. All of their care is a little more specialized. So in therapy, it involves a lot of play. That gets them involved. It's fun for them. They don't think of it as work when you do that. There's indoor and outdoor areas for therapy. There's a whole separate waiting area also for the rehab department for children.
Perfect. And that pairs nicely with something we'll hear a little later in the show, the Bow Center for Child Development, which Ochsner Hospital for Children brings to our market.
Yes.
So we really have a comprehensive level of therapy, outpatient, as well as what we've talked about, inpatient.
Yes.
I think as a parent of very healthy children, my perception of pediatric care tends to be just simply going to the pediatrician.
Right.
And our partnership really has that covered well too, Mandeville, Covington, and Madisonville.
Correct.
Can you talk a little bit about the Madisonville practice?
Yes, our Madisonville practice opened, and it was an area that used to have internal medicine or primary care there. We decided to transform that into the pediatric clinic. So it's staffed with a full array of pediatricians as well as nurse practitioners. So your children can go there. It's all geared towards children. They're all experts in the field. And as an added addition to that clinic, you can have a video visit.
That's video visit. Yes. Tell me about a video visit.
That's the new and upcoming thing. You can sit in your home and have a visit with your physician. Some parents have transportation issues. It's a time issue, traveling. They may have an appointment somewhere else, so you can do the video visit from an iPad, phone, anything like that. So you can schedule the video visit appointment and sit right there and speak with your physician just like you're in the office, except it's on video.
That's perfect. So as a parent, if I see my child has some suspicious rash or something that I can't diagnose as Dr. Mom, but it doesn't feel like something I want to make an appointment and go in, I might be able to schedule that video visit.
Yes.
And have the practitioner from the pediatrician's office take a look electronically.
Yes, yes, and as a matter of fact, that was one of the first cases we did as a video visit. It was a rash. Those are easy things that can be evaluated through the video. And they're also, we're looking at adding some things for a video visit so you can actually maybe put something in and let the physician visualize the ear or either listen to the child, things like that. So there's some things that can be added for that.
So more to come on
Yes.
video visits.
Yes.
Well, maybe we'll do a future show about
Yes.
it. Cindy, thank you so much for coming in today. We've been talking with Cindy Ingram Director of Women's and Children's Care at St. Tammany Parish Hospital. Up next, we'll talk with Melissa O'Malley, Assistant Vice President with Ochsner Health System, about the resources that Ochsner brings into West St. Tammany in our partnership, Ochsner Hospital for Children at St. Tammany Parish Hospital.
The North Shore. It's our place, where finer things are sometimes the simple ones. Social, sweet, and spirited, but always in harmony. Around here, life is about great things coming together. St. Tammany Parish Hospital and Ochsner, collaborating in the name of community.
Welcome back to Healthy Living. We're talking comprehensive pediatrics today. We've talked with Cindy Ingram, Director of Women's and Children's Care at St. Tammany Parish Hospital. And next we'll talk with Melissa O'Malley, Assistant Vice President at Ochsner Health System, responsible for pediatrics in West St. Tammany. Good morning, Melissa. Glad you're with us.
Thanks for having me. I'm happy to be here.
Super. Well, talk a little bit with us about Ochsner Hospital for Children at St. Tammany Parish Hospital. Ochsner brings a level of specialty care, primary care, and inpatient care into our partnership that helps us round out that comprehensive health system along the I-12 corridor.
Yes, I'm happy to do that. First, let me talk about our general pediatrics practice. We have 3 general pediatric practices located within St. Tammany Parish. That's a part of the partnership. We have St. Tammany's practice in Madisonville, and then Ochsner has 2 practices, one in Mandeville and one in Covington. So we pretty much cover the geography of West St. Tammany Parish with our general pediatric practices. All of the practices treat patients from birth to about 18 years of age, provide same day and next day access, and certainly are accepting new patients as well.
Outstanding. So that's certainly most of us as parents find ourselves interacting with pediatric care at that primary level. But sometimes children need highly specialized care, and those pediatricians may want to refer a patient into a multi-specialty clinic. And Ochsner Hospital for Children has a multi-specialty pediatric clinic in Covington as part of our system together. Tell us a little bit about what's available at that specialty clinic.
Yes, I'm happy to do that. Our Peds Subspecialty Clinic is located on Highway 21 in Covington, and it provides a whole host of subspecialty pediatric care that the community hasn't had previously. So some of the services include cardiology, pediatric cardiology, ENT, endocrinology. We also have pediatric oncology, hematology oncology, general surgery, and plastic surgery, orthopedics, pulmonology, and urology. So you can see we pretty much cover the gamut when it comes to this ped subspecialty arena.
An overwhelming list, but I am thinking if you have a child who has a congenital heart disease or juvenile diabetes, or if there's an incident or an accident, to be able to know that you have that level of specialty care right in Covington. I think we probably have a lot of parents who are presently traveling long distances to see those kinds of specialists in the pediatric specialty area.
Yes, that is what has been happening in the past. So adding these ped subspecialty services to the community is a response to the community asking for this level of care. So we're able to keep patients closer to home. And not only can patients be referred to the ped subspecialty clinic from local pediatricians or our pediatricians, but also we accept patient self-referrals as well. So it's easy to access this level of care right here in St. Tammany Parish.
Outstanding. Okay. Well, and you could talk a little bit, we've talked about the primary care pediatrics and about specialty pediatrics. Those are both on the outpatient side. Another aspect, and we talked a little bit with Cindy about this, is rehabilitation. And certainly the therapy and wellness facility with the pediatric certified speech therapy, physical therapy, and occupational therapy is really helpful to parents. But Ochsner Hospital for Children brings a special aspect from the Bow Center for Child Development. Here in Covington, there's a small piece of the Bow Center called Live Oak. Can you tell us a little bit about Live Oak?
Yes, Live Oak is a hidden gem in this community, and it's not really well known. But what Live Oak brings to the community is some very specialized therapeutic care for our special needs children. They are dedicated to helping children with developmental disorders overcome their challenges through intensive and comprehensive team-based care and integrated treatment protocols. They are committed to helping these children fully develop to the best of their potential and use the unique talents that they have.
Okay, so maybe a little bit different from, for example, a pediatric physical therapy. You might be doing some play therapy to help that child regain range of motion after an accident, or possibly there's some occupational therapy to help a child who's developmentally delayed with fine motor skills. But at the Bow Center or Live Oak here in Covington, you might have a child who has behavioral challenges that maybe even impede that ability to do physical therapy. And so at the Live Oak Center, they're able to take those behavioral and physical training together to work intensively with those special needs children.
That is true. And they also will be a resource and support within the school system as well. So children that are having maybe some educational difficulties or challenges in the classroom, they are able to connect with the schools, the teachers, the parents, and really all together come up with a plan that will help that child overcome some of those challenges.
Wonderful. And in St. Tammany Parish, where 18% of public school children have special needs, this is really a resource for parents to not have to cross the lake or state lines for care.
That is true, and we're happy to have this resource available to the community.
Outstanding. Well, we talk about using the name Ochsner Hospital for Children at St. Tammany Parish Hospital, and the idea behind that is to really show that level of specialty care that we're able to bring together, and I think that's an excellent example. You have the Live Oak Center, you have therapy and wellness with pediatric certified therapists, you have primary pediatrics in Madisonville, Mandeville, and Covington. We have the specialty care that you talked about, the pediatric multi-specialty clinic that has, I think, every level of pediatric specialty in there. That was quite a list you gave us. And then Cindy, of course, talked about your Ochsner Hospital for Children pediatric intensivists who are in our pediatric ICU and our pediatric inpatient unit, and how they coordinate with the pediatric emergency department 24/7, 365 downstairs. It's no wonder we're saying the most comprehensive health system for children along the I-12 corridor.
That's right, and we're proud to be able to offer this to our community. Like I said earlier, it was a response to what the community was telling us we needed to provide as healthcare, from the healthcare perspective here. And so we're happy to have partnered and accomplish that.
And we're excited too, from a St. Tammany Parish Hospital perspective. Our mission from the time we were founded in 1954 was to see to it that the care people who lived here needed was available to them close to home. And over the decades, as our parish has grown, become less rural and more suburban, our hospital has also grown. And 5 years ago, we forged our partnership with Ochsner Health System to recognize that we needed a larger organization to help us bring a level of specialty care that we really were not able to bring into the market alone. So we are excited to have Ochsner Hospital for Children at St. Tammany Parish Hospital in the 5th year of our partnership between the two organizations.
Yes, that's right.
Melissa, thank you so much for coming to join us today. We've been talking with Melissa O'Malley of Ochsner Health System, Cindy Ingram of St. Tammany Parish Hospital, and next we'll talk with Lori Cage of the Parenting Center. Together, they're talking about the most comprehensive health system for children along the I-12 corridor, Ochsner Hospital for Children at St. Tammany Parish Hospital. We'll be right back.
Thank you. Thanks. Thank you. Thanks for Sunny Face Eggs for my baby sister.
For my fishing buddy.
Thanks for my mama's gumbo. Thanks for my mom.
We enjoy receiving awards and recognition from our peers, but the true reward comes from seeing positive outcomes for our friends and neighbors. So thank you for trusting us. St. Tammany Parish Hospital, world-class healthcare close to home.
Welcome back to Healthy Living. We're talking comprehensive pediatrics today. We've had Cindy Ingram from St. Tammany Parish Hospital, Melissa O'Malley from Ochsner Health System, and up next we'll talk with Lori Cage from the Parenting Center. Together, St. Tammany Parish Hospital and Ochsner Health System bring the most comprehensive health system for children along the I-12 corridor. Good morning, Lori. We're glad you could join us.
Good morning, Melissa. Thanks for having me. You know, I love to talk about the Parenting Center.
Yes, and we feel that the Parenting Center really rounds out that comprehensive pediatrics that we've been talking about. Everything we've been focused on today is about the medical care that children may need, even healthy children going to primary pediatrics, and then all the way through the specialties and emergencies and everything else. Let's talk more for a minute about at the Parenting Center. It's not about health care, it's about parenting and grandparenting, supporting each other. Can you talk a little bit about what the Parenting Center has to offer?
I absolutely can. I feel like it is a fantastic community resource that is a hidden gem, that people just don't really realize everything that we do. That we've been around for 30 years, started with just a group of moms wanting to do something to help prevent child abuse and neglect. So they found that it was unrealistic expectations was one of the main reasons. So they asked the hospital if they could hand out brochures in the hallway. And from there, we grew into becoming a department of the hospital in 1999. And with the support of the hospital, that's what really, I think, bounced us to offering way more services and things out in the community. So we have a center where you can come, caregivers and parents, and it is a great place for bonding and socialization. And they come with the children, and we have a lot of grandparents and caregivers. In fact, our grandparents created their own little coffee chat on Tuesdays that the grandparents and the kids come, so it's really just a wonderful thing to do. And it's geared mainly for children under 5. I think once they start school, they're pretty much out of our realm until later on we catch them back with some of our classes for older kids.
Well, that's what I was thinking. I know we have a tendency to think of the Parenting Center for new moms, breastfeeding moms, moms of babies, but we have to stop and remember dads, grandparents, toddlers, preschoolers, and then as you said, once they get into school, maybe the children are not in the Parenting Center quite as much, but I think the parents really start to realize, you know, you have classes in parenting through divorce, and you have classes to help children understand how to deal with their anger. And I think from that teen perspective, you were kind of saying that they come back where you have a safe sitter training.
Yes.
So you're teaching those teenagers a bit of parenting skills for themselves.
Right.
And maybe for little charges, they can have a little business on the side, a little babysitting business.
Absolutely. That Safe Sitter courses, I wish I would have had it myself because I was the oldest, and you know, as the oldest you get thrown into watching those siblings. And but the Safe Sitter course is from 11 to 16-year-olds, and it, as well as that, we also teach them just safety in the home, keeping themselves safe with all the internet and social media and things like that. We kind of interject a little of that in there too. But the babysitting course itself, they learn infant and child choking, CPR, how to run a business, how to introduce themselves, how to be professional, how to stay safe, and also discipline techniques. I think that is just such a huge thing that you just don't know the different ages. I mean, even as a parent, they don't come with instructions. So you're thinking, okay, what do I need to do with this child to keep them happy and safe, you know, in their home? So I think that is just a fantastic course that we offer.
It does, and as a parent, I can tell you my daughter, who's an adult now, took the Safe Sitter course when she was 11 years old, and it enabled her to feel confident about staying home by herself, supervising her baby brother, and she did some babysitting through junior high and high school and used those skills she learned, not just about safely caring for other people's children, and certainly appropriate discipline to teach children that you are in fact in charge, but she appreciated the lessons about business. It had not really crossed my mind to talk to her about how to discuss with the parents ahead of time what your rate of pay should be, how many children you feel safe watching in the home, to set expectations going in for a business relationship. I thought that was brilliant, and I was really impressed with the program as a parent.
Yeah, and a lot of our programs, that as well as our cooking class, we do a Cooking Healthy Options and
CHOP,
Portions, which
Cooking
is an
Healthy
Ochsner
Options and Portions, yes.
which is also for 11 to 16-year-olds, and it's a hands-on. They actually cook. It is a little nerve-wracking as an instructor because you're giving them knives and hot cooking utensils and things like that. But both of those programs, we bring in guests, speakers. Like for the CHOP program, we have Chef Aubrey from the hospital that comes and he talks about knife safety and what I've learned a lot, what the different knives are for. I have all kinds of knives. I tend to use the same one, but now that he's instructed them,
you're learning a little bit
yeah,
too,
I'm like,
right?
oh, is that what that knife is for? You know, so you can learn a little better. And in Safe Sitter, some of their hands-on things they get is we have a 911 employee that comes and they practice doing a 911 call. They practice with a real, one of our members, and their children come and they practice introducing themselves and interviewing the parent and things like that.
That's wonderful. And I think both of those programs are good examples of how to circle back with those older children, because you're right, we do tend to think of the Parenting Center as a place for new parents to get some guidance, which it absolutely is.
Absolutely.
But it's also that wonderful place for grandparents, for teens, for parents of teens. So parents and caregivers of all ages benefit from the Parenting Center.
And every time I'm out in the community and somebody sees our name badge, they come up to me and they say, wow, I came to the Parenting Center when my children were young. It was awesome. It was the first time I could go to the bathroom by myself in months, you know, because we like to hold babies and we'll watch them while you take time.
Exactly.
We're knocking on the door saying, are you okay in there? Because you've been in there a long time.
I've held your baby.
Yeah,
Let me
held
give
your
you
baby
your baby
now.
back.
You need to come out. But that and the parent education that we do all kinds of parenting classes, everything from positive discipline, potty training, taming the temper, you know, just a whole plethora. And we've even developed classes based on people's needs. If we hear, you know, we get a lot of calls that people are interested in a particular topic, then we'll develop that program and offer it.
That's outstanding. And I know that you yourself are a social worker,
Yes.
licensed social worker, and then you have a program where you have interns who are studying social work. So there's
Yes.
a lot of behavioral and social professional influence in that play, support, and camaraderie at the Parenting Center.
Right, because you have no idea what people are going through. I mean, even when we start doing a parenting class, you know, Renee, our education coordinator, she was doing a class the other day and she came out, she was like, okay, and she's also a social worker. She's like, I think that almost was a therapy session, you know, because people are really stressed, but we create that environment of community and comfort that people feel like they can talk to us and get what the resources they need. That's what we're there for.
And I think that's the beauty of the Parenting Center. It reduces anxiety by providing education and support.
Correct. And we also, not just at the center, we go out in the community. We are on the road all the time, teaching at Head Starts, we teach at libraries, you know. So anybody that has a group of people, we do moms groups, we do parenting classes, just call us. We love to go out and visit.
We've been talking about comprehensive pediatrics at St. Tammany Parish Hospital and Ochsner Health System. Together, the partners bring the North Shore the most comprehensive health center for children along the I-12 corridor. Join us next month for a new episode of Healthy Living, brought to you by St. Tammany Parish Hospital.
Sometimes a presence is so steady you may not notice it changing. For over 65 years, we've been constantly innovating. And in partnering with Ochsner, we continue to offer the most advanced technology with minimally invasive techniques for general surgery and for specialties from orthopedics to neurosurgery. Many have noticed, earning us the most accolades on the North Shore for quality, safety, and patient experience. St. Tammany Parish Hospital in Ochsner, shaping the future of health.